everyone, my name is Nikisha and today my group and I would like to demonstrate how we test for extraocular eye movements today with my patients. So first, let me take you to the exam. Hi ma'am, my name is Nikisha Gasha, I'm a Year 5 medical student and today I just want to test the movements of the eyes. Is that okay with you?
Yes.
Can I get your name and age please?
Amrika Garb, 22.
Okay, nice to meet you, Ms. Garb. I'm about to begin the exam. I'll just ask you to stay seated and be relaxed as you are. And if you experience any pain or any double vision at all throughout this exam, you'll let me know and I'll stop, right?
Okay.
Okay. Now, with you seated right now, I would like you to just watch the top of my finger, please. Can you see it from there? Any pain at all or double vision?
No.
Okay, I want you to continue following my finger, right? Any pain at all?
No.
Any double vision?
No.
Okay, I want you to follow it again. Okay, thank you. One last time, I would like you to watch my finger and continue following it in, right? Okay, thank you very much, ma'am. That's the end of my exam. Thank you.
Okay, so now we'll be focusing on individual muscles, and for this purpose, we'll be examining the left eye. So, we're going to start with the medial rectus, which is supplied by the third cranial nerve, and it moves the eye medially. Now, we're going to be demonstrating the movement of the lateral rectus muscle, which is supplied by the sixth cranial nerve, and it moves the eye laterally. The superior rectus muscle is supplied by the third cranial nerve. The primary movement of this muscle is elevation of the eye. The secondary movements are adduction and intorsion. The inferior rectus muscle is supplied by the third cranial nerve. Its primary movement of the eyes is depression. However, the secondary movements are adduction and extorsion. The superior oblique muscle is supplied by the fourth cranial nerve. Its primary movement is intorsion. However, the secondary movements are abduction and depression. The inferior oblique muscle is supplied by the third cranial nerve. Its primary movement is extorsion. However, the secondary movements are abduction and elevation of the eye. The convergence reflex is a reflex action of the eyes in which the eyes draw inwards to focus on a near object. This involves the simultaneous contraction of the medial rectus muscles of the eyes bilaterally. To demonstrate this reflex, an object will be moved from the distance closer to the patient's face.
Nystagmus is an involuntary oscillation of the eyes that is often rhythmical, with both eyes moving synchronously. It may be vertical, horizontal, rotatory, or multidirectional. In lid lag, the upper eyelid lags behind the upper edge of the iris as the eye moves downwards. Third cranial nerve disorders can impair ocular motility, pupillary function, or both. It can present as diplopia, ptosis, and paresis of eye adduction, upwards and downward gaze. Fourth cranial nerve palsy impairs the superior oblique muscle, causing paresis of vertical gaze, mainly in adduction. Sixth cranial nerve palsy affects the lateral rectus muscle, impairing eye abduction. The eye may be slightly adducted when the patient looks straight ahead.